The worst place in hospital, the ICU, where doctors see you on your worst day of your life. In ICU, you can't bring a stuffed animal because it traps dust and could have germs on it. And no balloons, outside drinks, foods, gifts of fruit, and real flowers or plants for the reason of food or allergies. And turn off your phone. Leave your jewels and knickknacks at home. And don't come into ICU smelling like strong perfume or lotion. 30 to 40% of patients in ICU are sedated and on ventilators and could hear you but cannot respond because of paralytics and sedation. 10% to 20% of patients in ICU have a tracheostomy. A doctor cuts a hole where your throat is and puts a tube past your esophagus, larynx, voice box, and stomach to your trachea to help the patient breathe alongside the ventilator. 50% of ventilator patients are given oxygen cannula after being extubated from the breathing tube in their throats if being slowly removed off of life support works as planned. 15% to 20% of patients after ventilator removal have oxygen mask for a few weeks to months before graduating to oxygen cannula. 5% to 10% of ICU patients are on dialysis because of an alcohol use disorder, an infection, or, whoops, I took too much of my meds or over-the-counter meds. Patients in ICU are hooked up to heart monitor, pulse ox, blood pressure cuff, and arterial line, and an IV. Some ICU patients that make up 1%, 2% have had ECMO machine breathing for them, which is where doctors use your veins in your legs or limbs during a DKA episode or car wreck or an overdose, or failed. 100% of ICU patients have an IV in their arm, so a nurse or doctor can administer sedation or meds, antibiotics, or TPN. 60%, 80% of patients in ICU have Foley catheter. 30% to 50% of ICU patients have drains to reduce swelling or have one in their skull to reduce brain swelling. 40% of ICU patients have feeding tube. 60% of ICU patients have total IV nutrition. 60% of ICU patients get to go home with a, maybe I should enjoy life more. 10%, 20% of ICU patients are too far gone, even though ICU doctors have tried their whole best, alongside nurses, specialists. The Grim Reaper cannot, will not be controlled.